Asian Star Radio. Welcome along to this special programme. I'm Sabah Sadiq from the Asian Star Radio news team. Joining me in the studio today, I have Tessa Linfield, who's the Director of Public Health at East Berkshire. Tessa and I will be speaking about the COVID-19 pandemic and how we can remain safe during these turbulent times. Tessa, is lockdown having an effect? Are infection rates still going up?
So I'm pleased to say that it looks like lockdown is starting to have an effect across our area. We are starting to see rates drop now, which is really good news.
And how many infections are due to the new variant?
So the new variant really has taken hold in the south of England, and we're certainly seeing the majority of the new cases that we see now across our three local authorities, so Slough, Windsor and Maidenhead and Bracknell Forest, the majority of the new cases are the new variant, which of course is more infectious, more easier to catch and easier to pass on than traditional COVID.
And I think it's important to point out that it's more transmissible but doesn't affect you in a worse way.
No, exactly. The illness that it causes is the same, and it isn't any more serious disease from the new variant than from the previous variant. So for the vast majority of people, COVID won't be a serious illness. But for some people, it's a really devastating infection. And
is that because you have more of the viral load within your system and that's why it's easier to spread and catch?
Absolutely. So we know that the new variant of the virus is easier to pass on because you carry more of it, so it's easier to cough it out and pass it on to people, and you need less of it to cause you to be infected.
So the lateral flow tests, how effective are they at kind of like picking up the cases of people that are possibly asymptomatic?
Yeah, so we know that about 1 in 3 people who have COVID, who are infectious with COVID, won't have any symptoms. And the new test, the lateral flow test, is very good at spotting when you're in the period of time that you're infectious. So it's very good for identifying people who otherwise would be completely unaware that they're carrying COVID and could potentially pass it on.
Yeah, and I think it's important because I think statistics show that it's probably 1 in 3 people that have COVID don't know that they're actually carrying it.
Exactly. So any of us could have it and any of us could be passing it on, and it's really important that we know where we are and you know, if we do have it, clearly we want to do something to stop us passing it on to other people.
Absolutely. So when will the community testing start?
So we've already got community testing up and running in Slough, and we're hoping to start in Windsor and Maidenhead and Bracknell Forest next month. So we've submitted our plans to the Department of Health and we're waiting to hear back from them as to whether they're acceptable.
So how's it going in Slough? I know this has already started at the centre in the Farnham Road and the Langley College Sports Hall in Langley. So how are these all going?
Good. Going really well, actually. So we've tested about 2,500 people in Slough already, and we've found nearly 50 people who didn't know they had COVID and were infectious with it, so that they can now isolate themselves and break that chain of transmission.
You've also got some pop-up mobile sites across the borough as well, haven't you?
Yeah, so the model in Slough is a model where we're looking to test quite a large number of people, because clearly rates in Slough are much higher than they are in other parts of our patch. So it's a slightly different model that we're using in Slough. Yes, so we've got pop-up sites that change all the time. Just check out the slough.gov website and you'll be able to tell where the sites are that are near you.
And when are these going to be running until? And, you know, what tests are they running and how quickly will you get results?
So they're using lateral flow test. So lateral flow test is a test that doesn't have to go to the laboratory to get a result. So you have the test and the results are texted to your mobile phone. So the actual test result takes about half an hour. And then it's texted to your mobile phone so that you know exactly what your status is. With
regards to figures, I mean, how many people have actually been tested in Slough already?
So we've tested around 2,500 people, and we found around 50 people who didn't know they were infectious with COVID and would otherwise not have known.
Wow. Now, the government's saying that all adults in England should be offered a vaccination by autumn of this year. When do you think we will be vaccinated here in Berkshire?
So, I mean, I'm not directly involved with the vaccination programme, but that's run by the NHS, but they're doing a very good job of rolling the vaccine out. And I think we need to talk to the NHS directly to find out exactly how they're going and when they're going to get to us all. But the information that we have so far is that they're doing a really good job and they're on track.
Yeah, and I guess, you know, I think yesterday's figures were it was up to about 5 million.
Exactly. So it's really impressive. I think from a standing start, it's really quite amazing how many vaccines they're managing to get into the arms of people. So I really encourage people, if they're invited for a vaccine, please take up the offer. It's our way out of COVID.
Do you think that people are actually getting better at observing the government's health guidance? You know, the whole hands, face, space, and the lockdown rules on staying at home, not mixing with people. Do you think that message is getting through?
I think for the vast majority of people, they're doing their level best to keep COVID at bay, and clearly we all need to play a part in this. I think the fact that we're starting to see the numbers drop means that people have changed their behaviour, but it's up to us to keep going. I mean, if we really want this to end as soon as we can, we really do have to abide by the rules and stay at home. At the moment, we stay at home unless you've got a really good reason to go out. And of course, if you do have to go out and about, then make sure that you're obeying the hands, face, space rules, wearing a face covering when you need to, washing your hands a lot. Keeping that 2 metre distance between people is a really important one.
And they are very basic, simple rules. And it's not, the virus moving itself around, it's people moving the virus around. And if we just bear that in mind and stick to the hands, face and space.
Absolutely. I mean, it's people in contact with people that passes the virus around. And, we can break the chain of transmission by obeying those rules. It's really hard to keep up the effort, but we really do need to keep at it for the time being.
Do you think that some people are confused about the self-isolation rules?
I do think that isolation means different things to different people, but what it really means is that if you have COVID, or if you've been in contact with someone who has COVID, then you need to stay at home and stay away from other people. I mean, that's the key thing, is that it's contact between people that passes this virus around. So the key thing is to stay away from other people, to stay at home, isolate yourself and keep away from other people.
What's the best place for people to go if they want to stay up to date with the latest infection rates and the guidelines for our area?
So we have a website that covers all of Berkshire. It's berkshirepublichealth.co.uk. It has the case rates in there, the number of infections every day, and importantly, it has all the rules and regulations. So if you're a bit confused about what you can and can't do, it's all on there. Really encourage people to have a look. It's updated automatically several times a day, so it's really up-to-date information.
Yeah, that was the next question that I was going to ask you. How accurate is the information over the last few months, especially since Christmas? The rules and guidelines have changed very quickly, and trying to, as normal people trying to keep ahead of all those rules and guidelines, it's really vital that people have access to a resource where they're able to access up-to-date live information. Yeah,
so the Berkshire Public Health website is up to date. It gives you the latest. It gives you the latest facts and figures and gives you up-to-date information on the rules and regulations in different parts of Berkshire. So you can click on your local authority and it'll tell you how the rules apply to you there.
Thank you, Tessa, for your time today. It's been very interesting speaking to you. I hope we've got across some very vital information to the community out there. Are there any last words that you'd like to say for our listeners?
I'd just really like to thank people for the fantastic effort that they're making to keep COVID at bay. We just need to keep going. Stay at home, hands, face, space, keep going, and we'll get through this. So thank you, everyone.
Yes, we'll get through this, and we'll get through this together.
Absolutely.
Thank you so much for your time, Tessa. Stay safe.
You too. Thank you.